Foundational video number 2. We are going to talk about the importance of the thoracic spine. We have our lumbar spine, which is the lower part of the spine. We have our cervical spine, which is the upper part of the spine. And in between we have what's called the thoracic spine. There's 12 vertebrae in the thoracic spine. Your thoracic spine is supposed to move. It's not supposed to be stuck. I find a lot of clients as they age, they get stuck in the thoracic spine and they can't move properly. So today we're going to work on some stretches that you can get a little bit more mobility in through the thoracic spine. So the first one is you're going to be in a seated position with your feet flat, your head on your spine, the eyes are open. You're going to take your left hand down on the chair to stabilize your spine, right arm straight up, and without letting my right hip lift off the chair, I'm going to exhale and lean over to the left, getting a nice stretch up into the oblique area on my right. You're going to exhale on the stretch, inhale as you come back to center. Exhale and breathe, and back to center. Each stretch, try to go a little bit further, keeping your hip down on the chair. And I'm going to take it over to the other side. Left arm is up, right arm is on the chair. Exhale as you reach. And again, that hip stays down on the chair. Exhale and breathe on the stretch. Inhale as you come back. Exhale and breathe. Try to reach a little bit further. And what I want you to do is recognize what your right side feels compared to your left side. This is where we can start to become aware of the difference of the right and the left. In these foundational videos, we're trying to get the body balanced out. And the only way to get the body balanced out is for you to become super aware of what your right side's doing compared to your left side. And this is a great technique to figure that out. On the next stretch, you're going to place your left hand on the left thigh. Your right arm's going to be straight up. You're going to turn to the right, but you're going to reach over that left thigh, keeping that right hip down on the chair. Inhale as you come back up. Exhale, reach over that left thigh, breathing. Inhale, come on back. Exhale on the stretch, keeping that right hip down. Inhale, let's do one more. Exhale on the stretch and release it. Now take the right hand on the right thigh, left hand up, turn your body to the left, travel over your right leg. Exhale as you come over. Inhale. Again, I'm assessing what's going on to my right side compared to my left. And you're going to feel this stretch a little bit more into your back. It's a great back stretch if you get tight in through your lower back. And release it. The next stretch, you're going to take your left hand behind you. You're going to take your right hand up. You're going to turn to the left, and you're going to angle your body backwards, stretching the anterior tissue. Sometimes we forget about this because we're so tight in the back. But we're tight in the back because it's long, stretched out, and weak. And actually, this is the stretch that you need to do to take that tension off the back. Exhale as you go back. Inhale, let's take it to the other side. Right hand behind, left hand up. Turn your body to the right. Exhale as you travel back on an angle. Inhale as you come back up. And you should feel a nice stretch in the front on the left side. Feels really good to get this balanced out. Again, compare what your right side feels compared to your left. Nice. And release it. Now, keep your right hand behind you. Take your left hand on the outside of your right leg, keeping your lumbar spine stabilized. Keep your eyes open, your mouth closed, and you're going to twist to the right, looking to the back of the room. Inhale, come on back forward. And again, exhale, twisting through the thoracic spine, keeping your lumbar spine, again, stabilized. I'm not twisting my whole hips. I'm keeping my hips stabilized. I'm just twisting through the center. Inhale as you come back. One more. Breathe on the stretch. And release it. Let's take it to the other side. Left hand back, right hand on the outside. Lengthen the spine and then twist through the thoracic spine. Inhale, come on back forward and breathe. Again, compare. What does your right side feel compared to your left? Our goal is to try to get that evened out. Breathe on the stretch. Nice, and release it. Okay, working now up to the cervical spine. You're going to take your left hand back on the chair to stabilize, your right hand all the way over, and you're going to exhale and take your right ear to the right shoulder. Inhale, come on back. Stretching the left side of the neck, keeping the shoulder down. The reason you're holding on to the chair is to stabilize that shoulder. This muscle is attached from the shoulder up to the cervical spine. So you want to stabilize it. Exhale and breathe. And release it. Let's take it to the other side. Left hand all the way over. Shoulder stays down. Exhale and come on over. Inhale, come on back. Exhale on the stretch. Inhale, come on back. Again, you're comparing what your right side feels compared to your left. And back up. Let's do one more. And breathe. Nice. Now, take your right hand behind your head, 45 degrees to the right, and look down into the armpit, exhaling as you look down. Inhale, back up. And again, exhale, look down into the armpit. Inhale, back up. One more, and breathe. And up. Same thing on the other side. Take your left hand behind the head, 45 degrees, and then look down into the armpit, exhaling as you go down. Inhale as you come back up. And breathe. Again, you're comparing the right to the left, getting blood and oxygen into those muscles. Let's do one more. Exhale and breathe. And release it. Now both arms down. All I want you to do is look over your right shoulder, keeping your eyes open as far as you can. And then back to center, and then look over the left shoulder. Keeping your eyes open, look as far as you can. And again, look over the right shoulder. Try to look a little bit further to the back. And not twisting the body. Keep your body stabilized. Just let the neck muscles do the work. Inhale all the way back. I have clients that have come back and told me, after doing these neck exercises, it's easier for them when they need to turn their head in the car, when they need to look back when they're pulling back. Our muscles stiffen up as we get older. When they stiffen up, that's the only movement we'll go to. These exercises are to help keep the mobility in the body so that everything moves the way it's supposed to move.